Hello, everybody. Good afternoon. My name is Dr. Ahmed, and I'm here to talk to you about your preparation for the American Board. As you may all know, the American Board is considered the most prestigious certificate that doctors among the world want to hold. First, because in order to get it, you have to go through intensive training, and the second is it's acceptable everywhere. It's like gold. You can trade with everything. You can go almost every country, and this certificate will be valid. If there is any country that does not recognize the American Board, I would want to know about that country because, as far as I know, like I said, it's recognized everywhere. Europe, New Zealand, Australia, most countries. If you hold the American Board, then you're good. So, in order to get that prestigious certificate, you need to go through residency, like I mentioned before. In order to get into residency, you have to pass a series of exams called USMLEs, Step 1, Step 2, Step 2 two-part, CK and CS, and then Step 3. Step 3 is not mandatory to start the training, but it's mandatory to graduate from training and to get the unrestricted license, which make you eligible to take the board. So, which make you eligible to take your board. We are here to help you through that journey. If you are in our center, if you are using any of our service, we are more than happy to guide you through the registration process. If not, just go online, go through usmle.org, and you'll find all the information you need. There is one extra very important piece of information is for international grads, all international grads, whether you are a US citizen or not, whether you did rotation in America or not, if you did not go to an American medical school, you need to be ASFMG certified, because ASFMG is the body that regulates the internationals who want to enter or start their training in the United States of America. Step 1. Step 1 is the first exam that people go through, and to me, I think that is the most important step, and you need to be so prepared, and it's very crucial because in order to get into residency, many programs, they have a filter, and for that filter, they use USMLE scores. They use all scores, but Step 1 scores is the most used because they found that there is a correlation, statistically proven, there is a correlation between Step 1 passing and the board passing. So if you pass your Step 1 with a decent score or with high scores, that makes the programs want you. So that makes you way more marketable, because that tells the program director that person is real smart and that person can pass the boards. And which exactly what they want you. This is a very brief video. I want to make it so beneficial for everybody. So I'm going to speak about a very high yield stuff. And the most important organ, to my understanding, it would be the heart. It's so important that is the first organ that start to function in the embryo. It's not just in human, all vertebrate. The first organ that start to function is the heart. The heart start beat as early as 4 weeks actually. One of the most important and high yield stuff you need to learn about the fetus. Heart is the fetal circulation. It's a little bit different than the adult circulation. And that brings us to the big question. If you were able to make your knowledge in a way that you could answer why it's so different, why the fetal circulation is different than the adult circulation. Because the fetal is inside the mother's womb. The fetus has no exposure to the outside air. So, what's the heart main function? Circulate the blood, take the blood, the deoxygenated blood from the body, and that deoxygenated blood will be oxygenated in the lungs, and then that blood will circulate again. Lungs are not functioning because there is no exposure. Actually, lungs start to function when the baby first cry, with the change of the pressure, when the baby get born. So until then, what's the baby gonna do? The baby gonna use his mother's body to get what he needs. So all of you, respect your mommies. You were completely dependent on your mommies when you were that young. You cannot even take a breath without their help. So how do you breathe when you are that young? You breathe through the umbilical cord. You see, everybody has that umbilical stump. That used to be a cord, connect the baby to the mother. And in that cord, there's 3 vessels, 2 arteries and 1 vein. That's normal. There may be some anomalies. We're speaking about common things here because it's a very short video, but we will elaborate in the most important stuff later. And you will learn about this later when you go through your rotation and your OBGYN rotation. And we are back to the fetal circulation. So, for the fetal circulation, the main difference here is the oxygenated blood is transferred through the umbilical vein. The oxygenated blood is coming to the baby from the mother through the umbilical vein. And the deoxygenated blood leave the baby's body. That all happen through the placenta though, okay? And we can learn about how the placenta function later also. And through that, the deoxygenated blood go back to the mother's circulation so the baby could use the mother's heart and lungs to get the oxygenated blood. The umbilical vein actually, oxygen saturation can be around 80%. So that's a very good amount of blood, of oxygenated blood. So what happens to that oxygenated blood after it enters the fetus? What happens is blood entering the fetus through the umbilical vein conducted via the ductus venosus, okay, into the inferior vena cava, and that way they bypass the hepatic circulation because we don't want that blood to get into the liver, into liver sinusoid, and the hepatic circulation, which we'll talk about it maybe later. So that oxygenated blood will bypass the liver, go through inferior vena cava to the heart, enter through the right ventricle, because this is venous blood, okay? But it's oxygenated because it's not coming from the baby, it's coming from the mother. So it goes through there, and what happens is we have the foramen ovale. So that foramen ovale, most of that highly oxygenated blood reaching the heart via the inferior vena cava is directed through the foramen ovale and pumped into the aorta simply to supply the head and the body. And the deoxygenated blood from the superior vena cava pass through the right atrium, through the right ventricle, through the main pulmonary arteries, through the ductus arteriosus, through the descending aorta, shunt due to high fetal pulmonary artery resistance due to partially low O2. Why? Because baby is not breathing. Baby has no connection and the lungs are collapsed actually. They don't open, or they don't until the baby is born. At birth, an infant takes a breath, which decreases the resistance in the pulmonary vasculature and increase the resistance in the left atrium, and so that the baby will get the adult circulation. But that happened after the first scream. You know, when the baby screams, why everybody's so worried until the baby screams? Because when the baby screams, that means the lungs start to function. We're just moving quickly through a very high yield stuff. Okay? SA node and AV node are supplied by branches of right coronary artery. Why that is so important? Because when we have a conduction, like we say, why? You need to know, you need to correlate the knowledge. Why do we need to learn about the conduction system? Because the conduction system regulates the heart rate. And if the heart rate not as supposed to be, then that leads to arrhythmias. Some arrhythmia could be fatal, some arrhythmias lead to very fatal complication. So that's why we learn about the anatomy of the heart, because that way we know that the SA node and AV node are not functioning. So when there is right coronary artery defect, okay? So this is just a very important piece of information. And one more thing I would like to talk about briefly in this very short introduction is the ischemic heart disease, because I think ischemic heart disease are killer and they're kind of very preventable, and it's a very high yield for USMLE exams. So for ischemic heart disease, the most important risk factor is atherosclerosis. What atherosclerosis means? Atherosclerosis is hardening of arteries with arterial wall thickening and loss of elasticity. So when there is loss of elasticity, the arteries are fixed. Okay? The arteries are fixed. They cannot take extra blood, and if there is any blockage because the loss of the elasticity, that blockage would make complication to the amount of blood that circulating through that specific artery. And if that artery is providing blood to a vital organ like the brain or the heart or the kidney or whatever organ that is vital organ, that may lead to a very serious complication. So that's why atherosclerosis and is one of the major factors to ischemic heart disease. So nowadays, if somebody has atherosclerosis, they need to treat according to the guidelines. Ischemic heart disease may, because there is anything that's fixed with human being, but we know the most common way to happen. We learn about the most common presentation, at least at this level. If you want to become a cardiologist after doing 3 years of internal medicine, then you would come and teach us more about how the heart works. So, normally start with angina at rest, angina on exertion, then angina on rest, then it may be unstable angina, and after that unstable angina, patient may have myocardial infection, which is when there is a blockage to the blood to the heart for